All right, all you future Operation Theater technicians, welcome. Let's jump right in. Today, we're talking about something absolutely fundamental to your entire career, the surgical instruments that you'll be working with day in and day out in the OT. This is where it all begins.
So let's just start with a quick check-in. Just think for a second, off the top of your head, right now, how many surgical instruments can you confidently name and describe the use for? 5? Maybe 10? Hey, whatever the number is, don't worry. The whole point of this session is to give you a system, a way to understand any instrument. So that number, and more importantly, your confidence, is about to go way, way up.
You know, in the operating theater, everything we learn in books becomes real, fast. Handing a surgeon the wrong instrument, well, that's not just a simple mistake. It breaks the flow of the entire surgery. It can waste precious time, and in the worst case, it can actually cause harm to the patient. So this knowledge is your direct line to keeping patients safe. It is absolutely 100% non-negotiable.
Okay, so here's our game plan for today. First, we're going to talk about why this is such a big deal. Then I'm going to teach you a really simple system to classify any instrument based on 4 core functions. After that, we'll get hands-on with the essentials for cutting and grasping, then master the tools for control and closure. And we'll wrap it all up with a quick quiz to make sure it sticks. So let's get into our first section, navigating the tray. Let's really break down why getting comfortable with this sea of stainless steel is probably the first big hurdle you need to clear as a BOT student.
What I really like about this is how it breaks down your responsibilities. I mean, patient safety is always number one, of course, but right behind that is efficiency. A smooth surgery has a certain rhythm, and the surgeon is counting on you to be one step ahead, to know what they need next. That trust, it's built on your knowledge. And hey, let's be real, this is a huge topic for your exams, both the written ones and the vivas. You master this stuff, you're setting yourself up for success. Okay, so when you look at a full instrument tray for the first time, it can feel like total chaos, right? Just a jumble of metal. But I'm going to let you in on a little secret. There's actually a really simple order to it all. The trick is to stop trying to memorize hundreds of random names and start thinking about what each instrument does. Believe it or not, pretty much every single thing on that tray does one of just 4 things. It cuts, it grasps, it controls bleeding, or it helps close the wound. That's really it. And here's a great way to remember it. Think of the 4 C's of surgery. You cut, you catch tissue, you clamp a bleeder, and you close the wound. Cut, catch, clamp, close. If you can just ask yourself, which of the 4 C's does this instrument help with, you're already halfway to identifying it. All right, let's dig into our first 2 categories now, cutting and grasping. Now, these are the real workhorses of any operation. These are the instruments that are pretty much always in use, the ones that really get the job done. Now, this right here is a classic exam question. You've got 2 types of scissors. Think of Mayo scissors as your heavy-duty, tough tool. They're for cutting through thick stuff like fascia, or even for cutting sutures. Metzen bombs, on the other hand, look at them. They're longer, thinner, more delicate. They're for precision work, like carefully dissecting around something fragile like the bowel. And here's the golden rule. You never, ever, ever cut a suture with Metzen bombs. You'll ruin the fine blades and take a precision instrument out of commission. And here's another critical pair you have to know. Look closely at the tips. The Alliedverse forceps have little teeth that lock together. This gives a really strong, traumatic grip, which is fine for tough tissue that's going to be removed anyway. But now look at the Babcock forceps. They're atraumatic. See how the tips are smooth and rounded? They're designed to gently cradle delicate things, like a fallopian tube or the bowel, without crushing them. Can you just imagine the damage you'd cause using an Allis on someone's bowel? This difference is just so important. Okay, so the surgeon has made the cut, they've exposed the area. Now what? Well, now comes the part that requires real precision and finesse. We're talking about achieving hemostasis, which is just a fancy word for controlling bleeding, and then, of course, closing the wounds. So controlling bleeding often means using diathermy or electrocautery. And this comparison, this is a guaranteed exam question, I promise you. With monopolar, the electric current flows from the instrument through the patient's whole body and out through a grounding pad that's stuck to their skin. It's good for both cutting and general coagulation. Bipolar, though, is much more precise. The current only passes between the 2 tiny tips of the forceps. No grounding pad needed. This makes it way safer for delicate work, especially when you're working right next to a nerve you absolutely cannot afford to damage. Now, let's talk about closing up.
The suture sizing rule confuses everyone at first, so let's just make it super simple. The main thing to remember is that it's the total opposite of what you'd expect. The more zeros in the name, the smaller and finer the suture is. So a 10-0 suture, it's as thin as a human hair, used for microsurgery. A 4-0 is a bit thicker, maybe for closing skin. And then a size 1 or 2 suture is a really thick, strong thread for closing tough, deep layers. Just burn this into your brain. More zeros means a finer thread.
All right, you've got the framework, you've seen the main players, now it's time to put that new knowledge to the test. Let's do a few quick-fire questions just to make sure these ideas are really locked in. You ready?
Okay, first one. The surgeon is working very carefully around the bowel and asks for dissecting scissors. Which pair are you going to hand them?
Yes, Metzenbaum, exactly right. Remember the rule. Metzenbaum for delicate tissue, Mayo for tough stuff. Perfect.
Question number 2. The surgeon needs to gently lift up the fallopian tube to get a better look. Which forceps do you pass to make sure there's no damage?
You got it. Babcock forceps. The key word there was atraumatic. Babcock is for gently cradling. Alice is for grabbing and removing. Nice work.
Okay, last one. Simple, true or false for you. Monopolar diathermy requires a grounding pad to complete the electrical circuit. Is that true or is it false?
And the answer is true. Absolutely true. That current has to go somewhere, so it travels through the patient to that pad. Bipolar keeps the current right there at the tip. And that's it. You did it. You've run the gauntlet. You now have a solid, dependable system for making sense of the chaos on any instrument tray you'll ever see.
So now the real work begins. The question isn't if you're going to learn these instruments, it's how. So I'll leave you with this question. Which of those 4 C's are you going to master first? Cutting, catching, clamping, or closing? Pick one, focus on it, and become the kind of technician that your whole team can count on. Trust me, your future self and your future patients are going to